Arab migrants have a set of entitlements, not necessarily rights guaranteed by law, but they have a set of entitlements in other Arab countries. Entry, residence even without documentation, and access to public services such as primary and secondary health care in the public hospitals, but also primary and secondary education in public schools. And both Syria and Jordan, I'm not going to talk about Lebanon and Egypt, which have reacted differently, but also which are completely different contexts and have a much smaller number of Iraqis on their soil. But Syria and Jordan have opened their public services to Iraqis. Another thing is that the profile of the refugees in these countries is markedly different from the profile of the Afghans in countries like Iran and Afghanistan. The Iraqis who have been able to leave Iraq as of 2003 with an increase in 2006 are generally the educated middle class or upper middle class, including people with investment capital. This is something which is very rarely acknowledged. I mean, it is acknowledged that it is the educated middle class, people who were doctors, university professors, engineers, men and women from, urban areas with a high level of education, which has really created a depletion of human capital and resources for the new Iraq. But another category of people who have fled are really people with financial capital and who have invested this financial capital in the neighboring countries, in Jordan in particular, but also in Syria. And by doing so, they have also contributed to creating jobs, both for national of host countries, but also for their own people and for Iraqis. So it's a very unusual situation. I would say it's not a classic refugee crisis. And the framework which has been applied to it by the humanitarian community, in my view, has failed to take this into consideration. The framework that has been, the operational approach that has been used by UNHCR and NGOs, and which of course has been promoted to donors, the states or the EU being the main donors, has been that of the urban refugee crisis, which is a model which has been developed in Africa during the 80s in particular, and then in the 90s, to try to deal with these refugees whose normal situation was to be in camps, in particular in the region of the Great Lakes. And, humanitarian actors, particularly UNHCR, were used to dealing with providing services to refugee in camps where you can identify your clients, you can count them, you can absolutely develop data and information about their needs, and they are confined, they're easy to control. It's also very comfortable for host countries because it's a form of containment. And at a certain point in the 80s, these people started going out of camps because there were no livelihoods opportunity in camps, and they started to be criminalized by host countries. So it created a set of vulnerabilities, and there was a whole debate within UNHCR and the humanitarian community about developing new policy approaches for urban refugees. This model, which is now very much promoted by humanitarian actors, is being reproduced in other cases where refugees are not in camp, which has been the case for the Iraqis in countries like Syria and Jordan, Lebanon and Egypt. However, one thing which humanitarian actors have missed is that the normal situation of refugees in these countries is not to be in camp, and there are no specific vulnerability attached to the fact of not being in camp. So in many ways, the humanitarian response has been very inadequate, and there has been a lot of resource which has been wasted developing programs which were not adapted to the needs of this population, which needs jobs, ways of being self-sufficient, higher education, access to tertiary health care, because Iraqis are very much people who have health status which is the same as people from the most developed countries. There's a very high prevalence, for example, of cancer and diabetes, which is never what programs for refugees propose. It's always primary health care or secondary health care. And so, I mean, this adjustment process is taking time. It's now underway, but there is also a dire need to be a bit more creative with solutions and stop looking at Iraqis only from the refugee prism, and also enlarge the approach to look at migration regimes and how they could provide durable solutions for Iraqis in the region. Now, much less focus has been on the internally displaced inside Iraq, and much less funding from donor countries has gone to the internally displaced. In part, first, because the global framework for international intervention in Iraq has been that of reconstruction. It's like to say that Afghanistan is post-conflict, basically. So we are doing reconstruction, so we're not acknowledging the fact that there are humanitarian needs, and of course there is no budget line for humanitarian action. And that's one reason why IDPs who have humanitarian needs have gone lost in the process. Another reason is that security within Iraq was still very fragile until a year and a half ago. It has improved tremendously. It's not stable everywhere in each and every area of Iraq, but generally access by humanitarian actors has improved in large part, and it has become now possible to assess the needs of this internally displaced population, of which large groups, I mean, to give you figures are always very difficult to manipulate in these contexts, be it for internally displaced or for refugees, for a variety of reasons. We can discuss that later if you want, but estimates of IDPs in Iraq are that there were about 1.5 million people displaced after 2006, and probably 500,000 of them would have returned to their area of origin. But just before 2003, estimates by the Brookings-Burns project on internal displacement was that there were 800,000 internally displaced from the various policies of the regime of Saddam Hussein, of eviction. And so what has happened to these people also is very unclear. Now, the people who are displaced internally in Iraq have mostly moved to the cities. So there is also a large urbanization process, which is the case in all other large protracted refugee crises. They are also now mixing with the urban poor. What makes them different from urban poor? What makes people who have been displaced by sectarian violence in their neighborhoods different from those who, in the last couple of years in Iraq, have left the countryside because of a drought that has been going on for several years in Iraq and in several other countries of the Middle East, and they have become rural to urban migrants, and they live side to side with the IDPs in the same type of informal settlements or public buildings. It's very difficult to differentiate. So now that the international community is becoming a bit more capable of accessing these groups because of security improvement, one of the questions is, should programs be targeted specifically at IDPs, or should IDPs be segmented into several groups by looking at the most vulnerable as part of other vulnerable Iraqis who might not be internally displaced?